Welcome to students in this particular lecture of the disease Ascariasis. This disease is caused by nematode roundworm Ascaris lumbricoides. So you can observe these sketches drawn here. Male Ascaris, female Ascaris. They are little bit, we can say, different from each other. Male is with smaller length and female having tapering long body. We can observe here. Penial seed is found only in male. Characteristic feature of male here. Both shows lateral line and well developed cuticle on their body. That cuticle or pellicle protect these worms in unfavorable atmosphere of our intestine, right? But how disease get transferred? So let us discuss mode of transmission. So mode of transmission for Ascariasis or these worms. Here, the infected person, humans, when defecate in open places, then fertilized egg released by this female, right? Fertilized, not unfertilized. Only fertilized egg can transfer the disease, may enter into the soil. Those fertilized egg, if present in soil, then that soil may contaminate water as well as food, or any one of these two. If contaminated water or food consumed by a man, that is the definitive host for these worms, then eggs hatch into the intestine and releases larvae, and those larvae penetrate the gut and now enter into their target lungs. So in lungs, those larvae mature for a few days, up to 1 to 2 weeks, right? And after a little bit maturity, those worms again back to the intestine through the trachea pharynx. Okay, they follow the reverse passage from lungs to bronchioles, then bronchi, then trachea, and through pharynx we swallow these worms actually, and again back to the intestine. So these matured worms now target our intestine. They use their hooks and suckers for their survival, right? And then it develops symptoms. So complete life cycle of these worms may vary from about 100 to 150 days, okay? But after 60-70 days, they start reproducing, and live worms may found in fecal matter of the infected person, okay? So here, intestine is strongly affected. Sometimes in severe cases, they may form bolus of lot of worms and may block our intestine, right? Perforations may be there due to their hooks, okay? So symptoms are related with intestine as well as to the lungs, okay? But after their successful inoculation to the body, right, they develop a disease called Ascariasis, right? So let us found some, we can discuss now about their prominent features or symptoms, right here. So let us discuss one by one symptoms. So they target lungs as well as intestine. On maturity, they dwell intestine, of course. So symptoms of Ascariasis include abdominal discomfort. That is the major symptom. Abdominal discomfort. जिसे भी ये डिसीज होगा, सबसे पहले एब्डोमिनल सिम्टम्स अपीयर होंगे, राइट? और ये एब्डोमिनल डिस्कम्फर्ट का मतलब हुआ कि यहाँ पे इंडाइजेशन हो सकता है, यहाँ पे लूज मोशंस हो सकते हैं, राइट? यहाँ पे वोमिट हो सकता है, राइट? इट इज फॉलोड बाय डायरिया, vomiting. As infected, there may be fever. There is loss of appetite and weight loss, right? Person may lose weight. Person may lose significant weight right here and become so weak. Then there may be pneumonitis, inflammation of wall of alveoli, lung cell, pneumonitis, and the lungs related problems may also include like difficulty in breathing, okay, inflammation of alveoli, as well as entire our respiratory system is infected or affected by such worms, right? So here we can observe that their target lungs and intestine may strongly affected, and certain neurological complexes during migration of worms may also found in some cases. Neurological complexes in some patient only, that symptom may also found, right? So symptoms are related with intestine, means indigestion, leading to vomiting as well as diarrhea, loose motion, and person become weak right here. So intestine if strongly affected may need surgical procedures. Bolus in severe cases, that is blockage of intestine, blockage of intestine by these worms. And in such cases we can see that these worms may target or damage our intestine and leading to complete indigestion, right? Need surgical procedures in some cases, and the target also include lungs. So lungs and intestine both get strongly affected by these worms. So these are the symptoms, okay? So what about the test? Live worm may present in fecal matter after 60-70 days. We already discussed about that. So which are the tests for Ascariasis? So prominent tests of Ascariasis include stool test. Stool test is prominent, and there is a microscopic examination of fecal matter for those worms or their fertilized eggs, right? Eggs or worm if found, then person is said to be positive with these worms. And the treatment include destruction of these worms by anti-helminthic medicines. Anti-helminthic medicines, right? Like especially albendazole, ABZ, okay, mebendazole, and similar drugs, right? Any anti-helminthic drug is strongly effective against those worms, and they get destroyed, we can say, completely by these anti-helminthic medications. So there is a perfect treatment, but it need to diagnose the disease first, okay? So awareness is typically important in such cases. So we have to find different preventive measurements regarding control or prevention of Ascariasis. Female can lay up to 2 lakh eggs in a breeding season per day. Great breeding ability by such female. That's how we have to control the disease at rapid rate. By prevention. So how can we prevent the disease, spread of disease? So most prominent feature, preventive measure, is of course that is awareness, education regarding these worms, of course. But here we should prevent open places defecation first, right? Number 2, good hygienic habits should be developed by each and everybody, right? Good hygienic habit. Washing hands with antiseptic or any typical medicated soaps or lotions, solutions, right? To control the disease. Their eggs should be washed off completely, right? So after using toilet, we should wash our hands properly. Good hygiene, we can say indirectly, is needed in such cases. So we should avoid street foods, because if it is contaminated, it may transfer eggs. So this problem is more common in children actually, because they directly touch the soil and consume that particular contaminated soil, right? Or they touch those hands to food as well as water and make them contaminated, okay? So here preventive measures include simply prevention through awareness, education, and good personal hygiene, right? So we can definitely control this disease as well as similar disorders like typhoid and like we can say amoebiasis, okay, which are transmitted through, we can say, feco-oral route, okay? So all those diseases which are transferred by feco-oral route can be controlled by simple preventive measurements, but need to educate about that disease, okay? So if you get the idea regarding Ascariasis, then you can easily solve that particular question in your board examinations, as well as your all multiple choices and entrance exams, that is NEET, okay? Hope you get the point. Thanks for watching.